Monkeypox is a viral zoonosis. It's a virus that is transmitted from animals to humans. The disease symptoms are similar to those seen in smallpox patients, although less severe. Monkeypox outbreaks are not new and infections have been reported for over 50 years now, mostly in the rural and rainforest areas of Central and West Africa. However, in the 2000s, countries outside Africa started reporting cases, but they too were in limited clusters. Since April this year, the disease has spread worldwide, particularly in several non-endemic countries. Experts are still unsure why there is a sudden outburst of cases in many countries. Even though the virus existed for years, it is interesting to note that the WHO currently knows too little about the new modes of transmission of the virus. Studies are also underway to understand sources of the infection.
We don't know very much about very many viruses, mostly because this was a virus that was in Africa, but because it caused very few infections outside Africa, it was generally ignored. It was not a rich world virus where you would expect viruses to be studied quite frequently. But it is a virus where, from what we know from pox viruses, we do know a fair bit and enough to be able to handle the virus. We don't understand why it's now spreading in humans so much. But there are some things that are clear pointers to why this is happening. People's behavior has changed. So you can have a lot of people traveling, you get a lot of people in close contact with each other in some settings, and then they travel to other places, and then they cause infection in their communities. So the opportunities for the virus to spread now are much more than they were 50 years ago. So right now, many of the cases that have been described have been in men who have sex with men, but that's not the only group in whom it has been described. We've seen the infection in children, we see the infection in immunocompromised individuals, and it is these latter two groups that need to worry, because in them the disease can be severe.
Currently, the disease is spread to over 75 countries. More than 16,000 infections are reported. Experts suspect the current outbreak worldwide was fueled largely by sexual contact among men. The incidents were common among immunocompromised people and among the relatively younger population, including children. In India, 4 cases of monkeypox were reported till now, 3 of which are in Kerala and 1 in Delhi. The 4th infected patient had no foreign travel history, which caused an alarm among health officials. Dr. Suresh Kumar, MD of Lok Nayak Jayaprakash Narayan Hospital in Delhi, said the patient is currently being treated as per standard procedures and is recovering well. The union government has held a high-level meeting and the states have been advised to conduct strict surveillance. The Health Ministry has also advised airport and port health officers and regional directors from regional offices to ensure strict health screening of all international travelers at arrival. So should India be worried? All public health emergencies clearly don't turn out to be pandemics. In the last decade, over 6 diseases have been declared as public health emergencies, including swine flu, Ebola, Zika, but none of them overwhelmed the health systems. Even though human-to-human transmission of monkeypox is happening through respiratory droplets or close skin contact with lesions, the number of infected persons is limited, unlike the COVID outbreak. The monkeypox virus is also known for low case fatality rates. In Africa, the fatality rate is about 3%, and in the rest of the world, it is much less. Since it is closely related to smallpox, people who received a smallpox vaccine in the past may have some protection from monkeypox. Experts say it is not necessary to vaccinate the entire population. A Harvard publication noted that ring vaccination, or vaccinating only people around those who are infected, would suffice in containing the outbreak.
So right now, we need not to panic, but at the same time, we have to be more vigilant, more careful about the early detection of the cases, isolation of the cases, better surveillance. Surveillance is very important. The contact tracing, surveillance. So more focus on the prevention. As the disease is self-limiting, most of these patients recover very well.
Experts say even though there is no need to be worried about the monkeypox threat in India, health officials must be alert. While the disease outbreak is minuscule so far when compared to COVID, it could be restricted through prompt and effective public health measures.
If you like this video, share it and subscribe to Business Standard. For more news, views and insights, log on to www.business-standard.com. Do also follow us on YouTube, Twitter, Facebook, Instagram, Telegram and LinkedIn.
सब अच्छी दिख रही हैं यार, कौन सी खरीदूं?
ये तो वही बात हुई, 4000 शेयर्स लिस्टेड है, कौन सा लूं?
वो तो सबसे आसान है।
तुझे 5 पैसा नहीं पता?
अब तो सबको पता है। 5 पैसा पर है 4000 स्टॉक्स की रिसर्च, टेक्निकल टूल्स और इन्वेस्टमेंट आइडियाज। डाउनलोड 5 पैसा नाउ।
अब तो सबको पता है, investing made easy and rewarding with 5 paisa. Investments in securities market are subject to market risks. Read all the related documents carefully before investing.